Today is the 2nd of June 2015. This is Morning Express that you're watching. Well, it's time for us to take care of your back. On Tuesdays, we normally look at your health and lifestyle, and today we're looking at your back. Some of those back aches that you have, some of them, of course, may be serious. Others may just require for you to just take a chill pill and relax. And well, to talk to us about that, with me in the studio, I have Dr. Rajpreet Bal.
Thank you. It's a pleasure.
A pleasure having you. And she is the Assistant Professor of Anesthesia and Pain Management.
Yes.
Can I just call you Dr. Bal?
Pleasure.
Rajpreet is quite a long name. All right. Now, Dr. Bal,
Yes.
let's just start with the very basics. I'm sure there are many of us who suffer backaches for different and various reasons. And the tendency, especially if it is not too painful, it's to ignore the backache and possibly continue with your life until the day you cannot bear that pain anymore. Is there a way of categorizing and knowing that a particular backache is a bad backache that requires more attention, and there are those that maybe just require for you to just relax a little bit?
I think this is a wonderful question, because most of the time I would say to you, in our practice, we see patients once they have sort of exhausted the home rest. They have taken their Prufens, Panadols, and now they're just... Yeah. And I think most of the time I would say to you, at least the evidence between Africa and US or European countries is that we're quite similar in the incidence of how many of us have back pain, how it's treated and how long it lasts. So I think that overall, just seeing maybe the research done on that, as I would say to you, most of the time to do that bit at home is the way to go. But I think when to seek help, the important signs are when the pain has not improved and it's been maybe 3 to 4 weeks. And obviously there are signs where it's extreme, where these home measures are not helping, then definitely do seek your GP or such. But I think overall, within a month's time is a good time for your body to heal. So if within a month you don't think this is getting better, or the symptoms are maybe progressively, the pain is not improving or getting worse, I think it's time to go see your physician.
Okay. And this, of course, does not only apply if the pain is too much, it immobilizes you, for example.
Yeah.
Even if the pain was just a little bit, you can go ahead with your life as usual, but there's a pain.
Yeah, I think most of the time you'd be surprised that when people were brought into the hospital, even with mild, moderate pain, we treated them, we took some x-rays or MRIs or anything to diagnose what was happening in their pain. Overall, patients, when you compared them to the ones who stayed at home, took medications, took rest, when you looked at them in long-term, meaning in 6 months or so, there was no difference in how those patients did. Perhaps I could have given you an answer like, oh, truly your back pain is coming from a certain source. So I think overall in a healthy patient, I think the best way is try to see what you can do at home. But I think that the right time to see a physician or such is when you think this is just not improving. You're being limited in the work you do. Your home life is being affected. Maybe you can't just sit with your family. You can't go on outings. You are avoiding exercise. So I think when you see those signs, and this has been about a month, I would say to you, you're in good advice to come and see your physician.
See a physician.
Yeah.
Okay, I'm sure age is something that we could look at some point, and it plays a part, because I think what you'll find with most people with backaches, majority are probably over a certain age, and maybe this is something that comes up due to some of the stress that we give our back over time.
Yeah.
And I think, if I'm not wrong, the back is probably one that takes a lot of strain in your body in terms of when you're working.
Yeah.
And maybe some of the things we could look at are some of the causes that may bring this back pain. Could we just look at some of the general? What are some of the things that may cause back pain?
Sure. So I think that I can definitely tell you it's related to what we do. And I think that age is part of it. So you might say, well, the laboring man doing the heavy activity. Yeah, and I think there's certainly the back pains we see in them that relates to what the maybe more common causes are. And then there's certainly the aged group. So I think overall, when you take these two groups, you're looking at the fact that the common causes are usually there's a muscle strain. you have that feeling you lifted something, you picked something, you hear that snap.
Right.
And I think most of the time we can say it's likely coming from the muscular strain in your back. It's perhaps the wrong posture we use. It's that stressful traffic time in Nairobi,
right.
sitting there for hours. And the back is definitely an area that feels a lot of stress. So I think it's definitely, I think you can contribute it to our lifestyle, to what we do. And I think over time, then the stress is also felt in the other parts in your back. There is a bony component, so there's obviously some arthritis. There is the discs that can get painful as well. There are issues where there's, you know, the common secretarial jobs or desk jobs that also contribute. And even I can look at your chair here and I can tell you we need to get a better support for your back and stuff. So I think that even our posture contributes to the aging of our back. And certainly I can see backs that are you see the 70-year-old with the back that now you can see in a 40-year-old.
Right.
So what has changed? So I think it's from our lifestyle, is what we do. So I think that contributes a lot.
Okay, let's stay on lifestyle, and maybe let's start with those who possibly their job requires for them to lift heavy stuff.
Yeah.
Are there certain postures that would probably give you a longer time with your back, especially if your job entails lifting heavy stuff?
I think this is a very good question, and I think this is advice I give a lot of our patients who see us, whose mainstay or laboring work is what they do. And I think posture makes a tremendous difference to the longevity of their back.
Right.
So I think the first thing to do is, if there is a lot of manual or heavy carrying or lifting, is how to properly lift. How not to bend your back and lift things with your back per se is what you normally see. I think we all do that as well at times.
Naturally, I think you tend to just bend and lift it.
Yes, and I think what we always teach patients, that's one of the, I think the first things to do is listen to your patient and what they do. And I think the correct posture is to try to bend from your legs and your hips, is to sort of lift yourself to the ground, pick it up, use your legs and the thigh muscles to lift you up, not do this bend motion. So I think that lifting from your legs, strengthening your upper leg muscles, and doing that helps. Maybe putting yourself at the equal level to the weight you're carrying. You know, it's not certainly to put yourself at that level by bending.
Right.
It's to maybe squatting.
So that
lifting.
you use more of your muscles than your back to
Correct. And I think always try to tell yourself, when you're doing that you have something on your shoulders. That's what I always tell patients. You don't want it to fall, so you're not going to bend over. So I think pretending like you're sort of Atlas carrying that earth on your back and your neck, I think is a good way to think. I want to maintain those straight shoulders, so I shall then lift with squatting and those motions. So I think that will help. And I think most of the time even your employer, I think, should also help in terms that those support belts that you can put across your back also emphasize the straightness of your spine. So I think that in those instances, maybe, you know, I think it's helpful at times to maybe wear that support belt, is have it around your back. And I think that can also definitely help.
Okay, this I'm sure applies to those who consistently lift heavy weights. What about if once in a while I'm lifting that heavy weight? Does that also apply? Because I may just lift it once in, you know, every so often.
Exactly. I mean, I think you're right. It's also even that mom at home who picked up her child, and I think, you know, it's something
Suddenly
that happened to your back. So I think it does apply to us as well. I think it's a change in posture should be something we should all sort of, I think, maintain. And this advice of lifting from your hips or from that same sort of pelvic level up, I think is what I would say to is the best. Yeah.
Okay.
I think that will at least help with sort of these, you know, that 1 week, 2 week you were just lying around because you couldn't do much. I think those instances will improve.
Okay. All right, just to let you know at home, in case you're joining us now, with me is Dr. Bal, and we're talking about back aches and pains that may come as a result of different things. So far, we've looked at lifestyle and some of the occupation you have. Remember, this is a conversation that we welcome you to have with us. In case you have a question, in case you have a comment, you'd like to ask the doctor in the house today, Dr. Bal. Any question, feel free to do so. The numbers are displayed on your screen. You can also participate in this conversation via Twitter, and the Twitter handle is at Michael G. Gitonga. I think we have a call. Good morning. Yes, good morning.
Morning.
Yes, go right ahead. Is that Mary?
Okay, my name is Mary.
Yes, Mary.
Okay, I have a back pain since I got the baby. And I'm 34.
You're 34?
Yeah. I just turned 34 this month.
Okay.
Yesterday, actually.
Congratulations and happy birthday.
I don't do a lot of work. The only work that I can do is to wash the house, nothing much.
Okay.
Because the clothes are washed by the washing machine. I wonder what might be the cause of my back pain.
How old is your baby?
She is 2 years and 8 months.
2 years. And that's the only child you have, or is that
Sorry?
Is that the only child you have?
Yeah, I have only one.
All right. Thank you, Mary.
Okay.
All right. Remember, you can call or you can also tweet us, and that's at Michael G. Gitonga. Now, Dr. Bal, Mary with a 2-year-old child, and I remember earlier on off air you mentioned something that can contribute to backaches is childbirth.
Yes.
But maybe you can talk to Mary.
Yeah. I think, Mary, you are actually one of the more common moms who has a complaint with back. I think you are not one of the rare, I would say to you, patients. And I think overall what I would advise you is that certainly the labor, I think the age as well, the activities you're doing at home with the child being at home, I think they all contribute. After childbirth and the hormonal changes in the woman's body, backache is actually more common in women than it is in men. So I think what I would advise you is that this is something where you need to retrain your muscles again. The more common cause in this issue is that hormonal related changes bring about loosening in your back muscles that normally support your back well. Then overall in the year following the birth, you are sort of in those postures where it's sort of breastfeeding, you are lifting that baby, and none of this really lets your back heal properly. So I think what I would advise you is that this is where maybe strengthening the back muscles, doing a lot of exercise to tone your stomach, those also help to take away the weight from your back. And certainly sitting and watching is not something I would recommend. I think even when we advise you rest at home, I think we are perhaps giving you a false sort of belief that you should sit around and not do anything. I think this is where I would advise you to get back to activity, strengthen those muscles. This will take time, perhaps a few weeks of good physiotherapy to get the exercises to improve those areas. I think will be very helpful.
All right, thank you. Dr. Bal, still on lifestyle. Yes. Let's talk about our sitting posture, especially given that now with time we've changed our professions from going to the farming and all that. Now we sit on a chair all day in front of a screen. What's a correct sitting posture? Do we have certain chairs that possibly would cause us to have back pain over the long term? And what's your comments on that?
I think certainly our work life now, and especially most of us who have the desk type of jobs, I think that it's very good to know what sort of maybe decreases the pressure on your lower back. So I think we call it like ergonomic benefits. So I think one of the things would be is that your chair shouldn't be too low from where your hand is resting. So usually the recommended sort of is that you have it about 8 inches or so from your lap to your elbow height on your desk. So I think adjusting the height of your chair will help, especially if you're working on a computer or writing a lot at your desk. I think that helps. And even for the university students or so, I think this is something I would recommend, is that to practice this correct posture is to prepare you for your future. So I think sitting, then I think obviously, just as I think our teachers and moms used to tell us in school, keep your lower back straight. And I think it does help, because it's certainly removing the strain from your lower back, which is a more common area of arthritis that we see. So I think keeping your back straight per se, taking a few breaks every 2 to 3 hours to stretch your back, certainly doing some flexion of your back and forth and to the side. Doing that takes some pressure off. I think even those few minutes at your desk help. And to add a little bit of support to your lower back, which helps to sort of maintain the normal curve in your back and helps over time as well. So I think even if you might not have that comfortable ergonomic chair, is to maybe put a small pillow in the lower part of your of your back, and not sitting on too much of a soft chair. So I think it's, obviously it helps our bottom to have a soft cushion, but I think it encourages you to slouch. So I think having a rigid stool or a harder chair, firm, I think is more recommended.
Okay.
So.
All right, there's a question that's coming here, and this is in regards to a damaged disc. And is there another way of having this sorted out if you have a damaged disc that was revealed via MRI, other than surgery? And how does one go about the pain management? Okay.
I think this is one of those things where, in childhood you lose a tooth and you have that second tooth that will come out, and then in adulthood, once that tooth is out, you're sort of stuck with either replacing it or the dentures option. And I think this is a good question, because disc per se is, you're born with one, you will have one for the whole of your life. So I think
there's no replacement.
There is no replacement. And certainly in someone who is maybe not considering surgery, some are too young to consider surgery, and some perhaps don't want to go through that surgical option of replacing a disc. So I think my advice is, I think for all of us, is to take care of your back. Once you start seeing evidence that there is a degeneration, what we say arthritis, wear and tear in your back, please don't worry. A lot of the times this is something that your body also adjusts to. Just because a certain x-ray, a certain image tells you there is wear and tear, all of us will get wear and tear.
At one point or the other?
At one point or another. Okay. So I think over time is that lose the weight. Maintain a good weight for your body. That takes away the strain from that old disc. Okay, we'll come to weight just now, because I think that's also very much in lifestyle and ideal weight and all that. But we'll take a call from Patrick in Thika. Good morning, Patrick. Patrick, who is calling from Thika. Good morning.
Good morning to you.
Yes, sir.
I have this problem. Yeah, I have a sister who is having a back problem. Who is around 22 years. Sometime back around January, she was complaining about very sharp pain on the back. And when we went to the doctor, she was diagnosed with a cyst growth.
With?
Cyst growth in the uterus. She was operated, and after that, the pain did go. But now the legs are numb. She can't walk.
Okay.
Yeah, but the whole problem started with the pain in the back.
With a sharp back pain?
Yeah, very sharp back pain.
All right.
Which she was almost crying because of the sharp pain.
Okay.
Yeah, how can you help?
All right, thank you, Patrick. Before we answer Patrick, we have a call from John in Nairobi. Good morning, John.
Good morning.
Yes, sir. Go right ahead.
Yeah, I'm a physiotherapist. I just wanted to contribute a little on the discussion on back problems. Okay. Actually, these ones are usually common nowadays in the current society because of the lifestyle that we take, the kind of shoes that we wear, and generally on the posture that we take while sitting. So usually I wanted to focus more on Mary's question. I just wanted to advise her, or maybe while breastfeeding or while taking care of the baby, let her just ensure that her back is straight. She can use maybe a pillow to raise the baby so that she is not bending while breastfeeding. And in other house chores that she does every day, not that she doesn't do, but let's say if she wants to do maybe some cleaning or mopping, let her use a long broom so that her back is straight. And while picking something from the ground, let her use her thigh muscles more than her back muscles. So that, for example, she has to squat more than to bend.
To bend.
Yeah, because however much you do physiotherapy or you take more painkillers, or maybe you do more of hydrotherapy, but you don't change the things that you do every day, then the back pain are always there. Yeah, and again, for people who go to the gym for fitness, whenever they take weights, let their back be supported adequately so that more weight does not go on their back.
Okay.
Okay, thank you so much. Have a good day.
Thank you very much, John, for those wonderful words of advice. I hope, Mary, you captured that. And maybe you can just add to that before we go to Patrick's question on Mary's back remaining straight as she's breastfeeding, if she has to do some household chores. Your comments on that?
Yeah, I think John gave the perfect advice. I think it was wonderful to hear that, at least from his words as well. And I think that is the best, that even Mary to stay at home is right now is not to sit on that chair and watch work being done. I think I would advise her to sort of get back to slow activity and use sort of that don't bend from your back, do the squatting things, get the legs strong again. And again, with her posture, support her back, even when she's sitting, is to keep that upright posture, put the support on her back, even while taking care of her children, is to do that. And I think for all breastfeeding moms out there, it's very easy to sort of, you know, you're trying to do two things at once. So I think is to remember, you know, support that back. So in a year or 2 years, you're not having what now Mary is sort of having, this chronic back issues.
Okay. All right. We have the question from Patrick on behalf of his 22-year-old sister who started off with a sharp back pain, and eventually they found that she had cyst growths, and that was removed, but the pain has not stopped. In fact, if anything, it has progressed, and now her legs are numb and she cannot walk. Yeah.
I think Patrick, this is something that is very concerning, and I'm glad you called, because I think there's certainly signs where we tell you you must see a physician. And I think that Patrick's sister is displaying some of these things. I think her initial back pain might have been related to the fact that she was having a growth pressing on her back. And that certainly is something that occurs. So I think at that time that was treated. Secondly, is this leg numbness something that is related to her back, or is this something where, again, there's something pressing on the nerves as they are coming into that pelvis area where the surgery was done? So I think, Patrick, I would advise you is that I think that her initial treatment was done to fix the growth in her, the cysts. And I think the leg numbness itself might be now something else that's going on with her back. So I think I would advise Patrick is, please have her go see a physician. And I think on evaluation, we can give you a better answer. Is this still something cyst related, or is this actually now back related? And I think that numbness is one of the signs you shouldn't ignore. Pain per se, yes, you can treat at home, but I think numbness is a sign to see a physician immediately.
And there's something else that's going wrong, maybe the nervous system?
Yes, I think so. And I think usually your nervous system gives you these signs. It is either like that shooting pain that's continuing, or the numbness per se. And I think the longer nerves are not like bones where when you fix them, they go back. Nerves, once they have gotten pain and pressure over time, their healing takes much longer. So I think you need to address them earlier than you might have addressed maybe just a cut or so. So I think, Patrick, please encourage your sister to, I think, seek help, see a physician, and see how this can be addressed properly.
All right. We're going to be taking questions from Twitter shortly. I'll refer to them, but let me just take 2 calls first. Then we're going to go to some of the questions that are coming via Twitter. And we have a call from Eldoret. Good morning.
Good morning.
Hello.
Hello.
Yes, good morning. Mzuri kabisa. Kemboi, tafadhali ongea kwa volume, sauti kidogo.
Okay. Naitwa Abraham Kemboi.
Sorry?
Naitwa Abraham Kemboi.
Yes.
Kutoka Eldoret. Mimi mkimbiaji, nimekuwa shida ya mgongo nikikimbia. Huwa nikifika asubuhi nasikia mgongo inaniuma mpaka magoti kwa mguu mmoja ya right.
Okay.
Na niliomba daktari anieleze kama inaweza tibiwa ama ni hangman spike.
Okay, na sasa umesema inauma ukifanya nini?
Ni mkimbiaji.
Sorry?
Mimi mkimbiaji.
Oh, ni mkimbiaji. Okay. Okay.
Yes.
Okay.
So nikikimbia asubuhi, huwa inakuja kuniuma baadaye.
Okay.
So ningeomba daktari anieleze kama inaweza tibiwa ama imenisumbua for about 3 years.
Sawa.
Yeah, asante.
Asante Kemboi. We also have Jane in Kisumu. Good morning, Jane.
Morning.
Yes, to your question or comment?
Yes, I have been having a pain, a sharp pain on my back. Then I was told to go for an X-ray. Then the X-ray came out, degenerated disc. Then I was given some painkillers. Okay. Which is not helping me. In fact, I'm having a sharp pain on one side of the left of my hip.
Left of your knee?
Hip.
Hip, okay.
It's connected to the pain which is sharp right in my back.
Okay.
Yeah, it has been too much. And when I came from the other X-ray, I was told to go to another one, which is, it's called IMR. Yes, so I've not gone, but the pain is persistent, though I'm taking the drug.
Okay.
Yes.
All right, thank you, Jane.
Yes, thank you so much.
All right, two questions there. Kimboy is an athlete, and he says after his running exercise, he develops a back pain and also a pain on his right leg. So he's asking, can that be cured? And I guess the other question may be that before the cure is what may be the cause.
Yeah. I think Kimboy sounds like he's a very active person and in good shape. So I think this might certainly be related to overuse of the muscles and what he's doing. Is he properly stretching before exercise? I think one of the things I would recommend to him is don't just do the leg stretches, and that is also to focus on stretching his back as well. So proper warm-up is very important for athletes because that can attribute to a lot of muscle strain. Second is, again, taking care of your back when you're cooling down as well, is again relaxing those muscles. And I think the same thing applies to all of us who are avid gym goers. This is the same advice because this certainly is not a complaint that you see mostly in these common athletes. It's also for us who go to the gym occasionally. So I think, again, proper warm-up, proper cool-down. Third is, again, is what he's expressing sounds like this is a strain related. So once he's in bed, he's putting pressure on the side that perhaps is maybe where certainly a nerve root, it sounds like a nervous system issue is getting pinched, but that doesn't have to necessarily happen in the spine. It can also occur in the leg as well. So I think I would say to him, try these stretching things, try these modalities, try some massage as well and see if this helps. And if you see if something is persisting for 3 months, if this is something he's had now for a while, I think this is something that needs to be maybe go and get it checked out with the X-ray or investigated. All right,
we also have Jane in Kisumu who is complaining of a sharp pain. She's been for an X-ray, she was given painkillers, and it also affects her left hip because she has pain on the left hip. She has been told to go for an IMR, and she wants to know what's the way forward. What again could be the cause and what does she need to do?
Yeah. And I think Jane certainly meets that criteria of patients where you try the most sort of recommended therapy is she's had the medications, she's had a normal investigation from an X-ray that showed that perhaps she has some degeneration or wear and tear that we normally see. Now persistingly she's complaining of some hip issues as well. Now I think that getting an MRI is I think what she was recommended is basically what allows us to see beyond just the bones, what you see in X-ray, is to see if there is a compression of maybe her tissues, nervous system, spine itself. It gives us a clearer image. So I think, Jane, I would recommend that if this is what we tell patients is about 3 months of symptoms where you have tried the mainstay therapy as she has, is please go and get this MRI done. It will give us a better idea. Is this hip actually on its own painful? Maybe there's arthritis in her hip as well, or is this coming from her back on towards her hip? And the only way to know this is obviously a good exam. Second is if her physician is recommending she get MRI, that is, it actually is perhaps coming from her back. And we'll only know that by a proper test such as MRI.
Okay. Questions via Twitter. Remember the Twitter handle is @MichaelG Gitonga. And there's a question here from Jared who says, can one still have a morning run if you have an aching back? Again, another active
person. Yeah, right. I think, Jared, I would advise you that it's always recommended that you get back to your normal activity. Now, if this is something where you do, if you're doing the quick 5K in the morning in your 40 minutes or so, maybe slow it down, I would say. I think that do a proper stretch, then go ahead and do the fast walking. And then I think over a week or so, try again to improve that speed and overall see what you can do. Because if your activity is still being limited after 3 weeks, in terms that he can't again run to what he was doing before, is please go and see your physician. Yes, I think you should. Okay. So I would still encourage him to do these activities because they give us a lot of information.
Okay. Michael Mwanya via Twitter is asking, does the drug injected on the back in the theater during operation have side effects? I guess this now you put on your anesthetic.
I think he's referring to the fact that there are certain patients who qualify for epidural injections to improve the pain in their back. And the medications normally that are recommended for use in theater are form of steroids, which are anti-inflammatory. They work sort of like Profen does. The benefit being that they are injected into and near the area of the problematic or where your nerves are the most, I think, inflamed. The side effects, I would say to you, normally are you can notice them in a few days. This steroid is not the same as what people take by mouth. So this steroid itself has low side effects in terms of lowering your immunity or such that we see with oral steroids. But this steroid itself can still raise your blood pressure for a few days, not for weeks. Maybe the first 2 to 3 days, it can raise your blood sugar. So most patients might complain of maybe notice increased fatigue, more perhaps feeling of warmth, sometimes a pressure feeling in their head. And this is likely due to the increased blood flow and headache sort of issues come about and they're more sensitive. Now the procedure itself, perhaps there's a risk of infection itself. This is not related to the drug. This is our needle just going through your skin. So I think there's also the local side effects of infection. There's a risk of headache from the procedure itself. But the injectable drug itself is quite mild. So the side effects, I would say to you, are very limited. Okay. Yeah.
All right. Remember, we're talking about back aches this morning. And if you'd like to call, the numbers are on your screen. To tweet, it's at Michael G. Gitonga. And yes, now that we're going to talk about lifestyle, let's talk about shoes, especially ladies' shoes. Do those have an effect on their backs?
Yes, I think even I can tell you, if you could see my shoe habits from when I was 20 to, I won't tell you my age, but I certainly have changed to wearing those high heels and, you know, maybe perhaps with a lower heel these days. So I think a lot of it has come from, obviously, my experience, my advice, and what I've seen in patients. So I think you have a wonderful question. So ladies out there, I think that heels do make you look great, but I think that they do attribute a lot to pressure on your back. So I think that in your young age, definitely there is that, you know, you are into fashion, you're doing these things, but I think your normal daily shoe should not be more than maybe a ½ inch on your heel. The reason being that you are actually causing more of a curvature in your lower back, which adds to strain across your buttock and lower back. So maybe towards the end of the night, you're noticing sort of that lower back, like achy feeling, maybe the soreness in your legs, etc. Then those are all contributable to your shoes. So I think that give your back a break. It's hard to tell someone don't wear these at all, but I think that if you are getting symptoms of back pain, is to give your back a break for a while, and that could mean even 2 weeks of wearing just smaller heels. There are attractive low heel shoes now. There's even, I would say to you, supported shoes where they give you a good support in your arches, and that also helps in sort of alleviating that back pain. So please go and get fitted for a good shoe, ask for a good arch support, and once in a while give your feet and back a break. Wear those flats.
All right. Thank you very much, Dr. Rajpreet Bal.
Thank you
for joining us today, Assistant Professor of Anesthesia and Pain Management.